Hello to all students. In this video lecture, we are going to discuss cardiac murmurs or heart murmurs. What are cardiac murmurs? Cardiac murmurs are special sounds produced by blood flow through the heart. These sounds are known as whooshing or swishing sounds, which are made by rapid and turbulent blood flow through the heart. So, to understand the cardiac murmur, first of all, we have to look at the anatomy and physiology of human heart. As you know that our heart is composed of 4 chambers, 2 atria and 2 ventricles. Deoxygenated blood from all over the body through inferior vena cava and superior vena cava enters into right atrium, and from right atrium it enters into right ventricle through valve. From here, blood moves towards pulmonary trunk and into the lungs for oxygenation. After oxygenation, oxygenated blood comes back towards heart through pulmonary veins into left atrium. And from left atrium, it enters into left ventricle. And from here through aorta, it is transported to different parts of the body. So during this during this flow of blood through heart, for some reason or other, turbulent sound is produced, swishing sound is produced by the flow of the blood. So how can we know that we are experiencing cardiac murmur? Sometimes we can hear with our ears, and sometimes we need to use stethoscope to hear these sounds. So what are the common symptoms of cardiac murmurs? Let's look at them. Mostly the most important symptom is blue or gray fingernails or lips, which is a sign of poor oxygenation. That is a sign of a cardiac murmur. Chest pain, persistent cough, dizziness, fainting, heavy sweating, even without doing any physical exercise, shortness of breath, swelling, sudden weight gain, swollen neck veins. So these are some important symptoms of cardiac murmur, but these symptoms can vary person to person depending upon the condition of the patient. So what causes these murmurs? What causes these sounds? So there are some certain defects in the heart, sometime during development and sometime during the adult age, which can lead towards cardiac murmurs. Number one, holes in heart, which is usually happens at the developmental level. When an infant is born, usually it has a small hole which automatically filled out, and if this hole is left open and does not completely close, then cardiac murmurs can be produced. Cardiac shunts also, it happens at the infant stage or in early childhood, where the cardiac valves and cardiac chambers cannot pump the blood properly, so cardiac murmurs are produced. In the adult age, usually calcium deposit is the main reason. High level of calcium in the blood can accumulate calcium deposits in the atria, ventricle or in the valves, which makes these valves and atria and ventricle hard, and it is difficult to pump the blood through these hearts, and it needs lot of pressure, and there are narrowing of the valves and narrowing of the chambers. So that is why cardiac murmurs are produced. Infection of inner heart membrane, which is known as endocarditis, due to some reason, some microorganism can be transported towards inner chamber of the heart, where they can cause infection, which can also lead towards cardiac murmurs. Other than that, rheumatic fever, simple fever, hyperthyroidism, and physical activity like exercise and pregnancy can also lead towards cardiac murmurs. How can we diagnose? Sometimes these murmurs can be heard by our ear, but sometimes we have to go to our doctor, and doctor use stethoscope to hear these sounds. And other than that, X-ray, chest X-ray, ECG, electrocardiogram can also be performed to determine the cardiac murmurs. If a person is diagnosed with cardiac murmur, then the treatment depends upon the type of the murmur. So there are different types of cardiac murmur. Let's look at them. Diastolic murmur. Diastolic murmur is usually happens when our atria, both atria, right atria and left atria are filling with the bloods. Systolic murmur usually happens when our right ventricle and left ventricle contract and blood is pushed towards lungs and body, so the sounds are produced. Continuous murmurs are those murmurs which happens all the time in the heart, and you can listen every minute of every second. As you know that our heart produces a sound which is known as loop dub, loop dub. So the sound of the heart, which is loop dub, changes during the cardiac murmur, and there is a swishing and swooshing sound. Swishing and whooshing sound is produced during heartbeat, during blood pressure. There are some other types of cardiac murmurs like harmless, which is innocent murmur. This is usually happens in the early age or during in the infant life. Worrisome heart murmur, which usually happen in the adult age, and we have to take care and we have to treat it. Usually harmless murmurs can automatically treated by themselves, but worrisome heart murmurs can be treated by certain medication, and sometimes we have to perform surgery. So what are the treatment options? If we are diagnosed with cardiac murmur, then there are different treatment options available. Number one, anticoagulants, which are blood thinner, which can be used if a person is having blood clot issues. So these anticoagulants medicine can dissolve those clots and prevent the arrhythmias and cardiac murmurs. Water pills, which are diuretics, if the patient has large volume of fluids in the body, then these diuretics can be used to remove the excess amount of fluid and the water from the body, so that cardiac murmurs can be controlled. Angiotensin converting enzyme inhibitor are usually used with people who have high blood pressure. So these type of medication can lower the blood pressure and helps in the controlling of the treatment of the cardiac murmurs. Beta blockers are also used to lower the heart rate and blood pressure, which ultimately helps us to treat cardiac murmurs. And if these medication treatment does not work, then we have to go towards surgery if there is a hole or if there is a blockage in the valve, and surgery is performed to open that atrium, open that valve, or open that part of the heart. So that's all for today. See you in the next lecture.